slides to
Yep.
what you'd like them to be. So when we last
Yep.
we left heroes, we were on the Sally Ride slide.
Terrific. Thank you so much. So yeah, so as the first US woman to go to space in 1983, Sally Ride's mission on the Space Shuttle Challenger heralded this, new era of progress in relation to women's access to Antarctic fieldwork. Because if women could survive in space, then they certainly could survive in Antarctica. So Ride's mission was also interesting because it uncovered NASA's ignorance of women's biological functions. So, it's been stated that one reason that a North American woman hadn't been sent to space until 1983 was because of NASA's relative inexperience with menstruation and female contraception. So women were excluded from spaceflight because their sort of hormonal bodies were too unpredictable, making them emotional liabilities. It was also suggested that menstruating in microgravity would cause pain or other health issues. Next slide, please. So in redesigning the spaceflight kit for Ride, NASA engineers famously asked her if 100 tampons would be enough for a one-week mission. Now, whilst there's some work emerging around menstrual health in space today and in other extreme environments like military deployments, particularly around induced amenorrhea, there's been quite literally no work exploring this topic in relation to Antarctica or the poles. So I argue then that this lack of infrastructure to support menstrual health in Antarctica and elsewhere in extreme environments is a particular form of sexism that maintains the lower status of menstruators relative to those who do not menstruate. So for instance, although my study focuses primarily on people who identify as women, of course, people of a range of different gender identities menstruate, so trans and non-binary people, and their experiences also need to be recognized in the development of fieldwork practices to support menstrual health. So throughout this talk, I'll use terms like people who menstruate and menstruators in solidarity with people from diverse gender groups, and also just to continually flag that menstruation is not just a female experience. Next slide, please, Shana. So before I get into my data, I'll just give you a very quick overview about sort of where feminist scholarship sits in relation to menstruation. So, as I just said, it's important to recognize that menstruation is experienced by different social groups. It's not just women, but feminists have been engaging in sort of menstrual scholarship for several decades now. And some of the key themes coming out of this work are really around menstruation as a product of social stigma. Feminists have been writing a lot about menstrual taboos and social norms about how women manage their reproductive bodies. And for the most part, over several decades, this scholarship has focused primarily on cisgender women and girls. So for instance, from an early age, girls are taught social norms around menstruation and how to keep their bodies private and clean. And of course, now there is this $40 billion industry built around sort of capitalizing on feelings of shame around menstruation and all these products to support it. Next slide, please. But menstruation is also a key topic in terms of the workplace. So for instance, endometriosis accounts for significant productivity loss for women in the workplace. But the thing is that most workplaces still aren't set up to provide adequate supports for people who menstruate or may experience things like endometriosis. Scotland was the first country to actually introduce a universal scheme for free menstrual products at work. And that's becoming more popular now in other places, but it's still rare in the grand scheme of things. And also the notion of menstrual leave is now being introduced in some contexts, but again, we don't have a lot of data to support how effective it is. Next slide, please. So like space, menstruating in Antarctica is complex to manage, and it's really difficult to adhere to social norms around menstrual etiquette because there is limited access to safe, clean, and private sanitation and disposal facilities. So managing bodily fluids in Antarctica requires practice and pre-planning. But the thing is that people who menstruate in Antarctica are still largely left on their own to support their bodily needs in fieldwork, mainly because fieldwork environments are just not set up for them. So key issues related to this include, which products to use to manage menstruation, how to dispose of them, how to manage this in relation to your field clothing, issues of privacy, and also whether or how to use, which menstrual suppression technologies to use. Next slide, please, Shana. So for instance, in many areas of Antarctica, you can only toilet in certain places, and collecting all waste is part of environmental management procedures. So one of the most tricky issues for women in Antarctica is going to the toilet. And of course, you can see an example of a luxury toilet there on the slide from a field camp. So basically all your bodily fluids need to be collected separately in sealed containers and then carried back to the station for incineration. So expeditioners who menstruate then need to consider not only what products they're going to use, but also how they're going to dispose of them. Next slide, please. So women tend to use female urinary devices to go to the toilet in the field. And the thing is that it takes quite a lot of practice to use these properly. And often, depending on where you are, how extreme your field camp is, you often have to use urinary devices in the view of other people. Next slide, please. And so from my research, women in space have also had similar problems using a sort of funnel toilet system. As I understand it, NASA recently spent $23 million on a toilet that accommodates female anatomy better. Next slide, please. So depending on the field setup, expeditioners may or may not have access to a private toilet facility, and this may result in different considerations around privacy. So on the slide, it's not very pretty, but you can see a piss pull. As you can tell, this is where you're going to urinate, and there isn't much privacy, and you basically have to do your business out in the open view unless you build some kind of sort of screening around you at your camp. So expeditioners similarly need to be prepared to manage their menstruation in shared spaces. So for women, trans and non-binary people, this can be uncomfortable. It can feel unsafe, particularly in cisgender, male-dominated field teams. Removing Antarctic field gear is another important consideration in managing bodily fluids. So as you can imagine, expeditioners wear significant clothing, they wear many layers, and so menstruators basically need to be able to change their menstrual products in such a way that it doesn't expose their skin to the cold for prolonged periods. Menstrual cycles also obviously change due to change in relation to the time zone, levels of activity and exercise, stress, circadian rhythms. So this might affect the number of supplies required, and it also necessitates sort of always carrying menstrual products in the case of unexpected bleeding during remote field work. Now, people like space, people who have worked in menstruators who work in extreme environments have often relied on menstrual suppression technologies during long duration expeditions. So, they use short-acting reversible contraception, the combined oral contraceptive pill, the mini pill, and also long-acting reversible contraception like an IUD. Now, of course, contraception is preferable because pregnancy is contraindicated in extreme environments like space, like Antarctica, and there is a strong need to reduce pregnancy during Antarctic expeditions. So, for instance, overwinter expeditioners are in Antarctica often between 12 and 15 months. So choosing to use a menstrual suppression technology may depend on how easily somebody can take a pill, for example. An expeditioner would require at least 365 tablets with redundancy for a 12-month mission, whereas larks require no extra supplies, little maintenance once they're inserted. However, of course, there's a chance of breakthrough bleeding, depending on when it's inserted and sort of whether women have a chance to test out various methods before they go. Most menstruating Antarctic expeditioners learn about menstrual suppression from other expeditioners. So in most national Antarctic programs, expeditioners are not briefed on menstruation in advance of a deployment. Now, this is a significant issue because if an expeditioner wants to induce amenorrhea, they need at least 3 to 6 months to consider the effects of any technology that they use. So now I just want to give you some quotes, and here you have on the slide, these bring into focus some of women's actual experiences dealing with these issues. So, as you can see on the slide, women are so underrepresented in polar field work, basically that no one even expects them to be there. and women really just need to figure it out on their own. So this extract shows the sort of mental energy that women expend on menstrual trouble. So for the woman in this extract, it's really the experience of undoing her suit and discovering these sort of great big red globule bits and urinating in a see-through bottle that stands out the most for her. However, the lack of privacy also means that women have no means of concealing their menstruation from other people in their teams. And so without appropriate facilities and in these male-dominated teams, women are just socialized to hold it and not urinate or not deal with their menstruation to avoid social embarrassment in the field. And of course, this stands true in other field environments where toilet stops are not built into field schedules. And this is really unhealthy because it can cause, for example, UTIs. Next slide, thank you. Now, the woman in this extract experienced direct criticism from her male colleagues when she told them about the fact that she needed a rest because she has endometriosis. I mean, this just shows that women are supposed to conceal their menstrual pain, take painkillers, and they're just supposed to carry on with their normal lives to manage the shame of menstruation. And here, her role in an Antarctic field team really conflicted with the chronic pain associated with her endometriosis. But this situation also may arise in this context because sometimes the disclosure of menstrual pain can be interpreted as women just wanting to get out of work. And in this sort of environment, it just sort of reinforces this environment of toughness and physical invulnerability that's associated with the heroic men of Antarctica. Next slide, please, Shana. So participants also talked about the fact that managing menstrual health in the field was made unnecessarily difficult, in part because there is just this culture of silence around it in national Antarctic programs. So, because women are so underrepresented, the women I spoke to just talked about the fact that they literally did not have access to other women to talk about menstruation, and therefore they really had no idea what they were doing in some of their early field trips. I mean, in this sense, women's bodies are sort of positioned as these operational challenges in Antarctic environments. But what I loved about talking to women is that they had all these amazing strategies for managing this. And next slide, please. So, for instance, the woman in this extract talks about the fact that she literally made her own detachable undies so that she could easily change her clothing in the environment without having to expose herself to any of the men in her team. Next slide, please. And indeed, women often just found it easier to adapt to a masculine field culture rather than changing it. So not only did women have to be prepared to work, but they also did this against a kind of backdrop of broader patriarchal ideals that devalue women's bodies and their reproductive capacities. So, I mean, it's sort of unsurprising that women that I spoke to perceived their bleeding as a kind of crisis that had to be managed. And often, women really described managing menstruation just in ways that avoided embarrassment or inconveniencing themselves, and particularly men. And this is really challenging in the field where privacy and toileting is very rare. Next slide, please. And what I was most surprised about was the fact that information about menstrual suppression was really taboo, and it was strategically disclosed between women only. Most women I'd spoken to had never heard of menstrual suppression until they'd heard about it from another woman. And this really speaks to the need for national Antarctic programs to provide all of this information well in advance so that people who menstruate can make informed choices about their bodies before they deploy to Antarctica. And it was really the risks associated with certain technologies that stood out among these women. So, for instance, several women had to stop using various technologies because they were getting breakthrough bleeding. And one woman noticed, as you can see on this slide, she talked about the fact that there are no tampons in field kits, but there are condoms everywhere. And so this is an obvious issue of social equity in Antarctic environments. Next slide, please, Shana. So, I mean, really, women in male-dominated field teams have to manage menstruation in environments that are largely insensitive to their bodily needs. the women in my study had all these different ways to practically conceal their menstruation in line with these sorts of social norms. But really there's no infrastructure for them to do it safely or properly. So women ultimately undertake all of this extra psychological and physical labor to manage menstruation while doing their very difficult job in Antarctica. They change their menstrual products without privacy or adequate sanitation. They carry bloody menstrual products around with them in the field for long periods of time till they can get back to station. They improvise menstrual products when none are available. They keep products in their bodies for longer than recommended because they're not provided with adequate toilet stops. And then they alter their hormonal balance with medications to make menstruation less inconvenient. So whilst these women found lots of ways to individually cope, the more concerning issue is really that people who menstruate are compelled to sort of fit into this system that is set up for men. And they have to meet masculine organizational norms. So, I mean, it goes without saying that all of my recommendations on the slide are really based on trying to really destigmatize and normalize menstruation. So including information in field manuals, making menstrual products available, easily accessible to everyone on station and in the field. Training particularly cisgender male field leaders in appropriate practice around toilet stops so that everyone is comfortable. And actually, this is a big issue for older men in the field too, because lots of men talk about the fact that, you know, having prostate problems means that they might need to urinate more frequently. So having proper toilet stops is appropriate for all expeditioners, not just menstruators. I actually, one of the best things that came out of my time at the AAD was that I updated the 2021 Antarctic Field Manual to reflect some of this information. So if we can just go to the next slide, Shane, I'll show you an example. So here, for example, I put in all sorts of information about how to use a urinary device. What should you do when it comes to managing menstruation in the field? This is information that had never been in the field manual before. Now we're talking about more than 40 years of people going to, of women going to Antarctica. Next slide, Shana, thank you. And so these are just some of the other topics that I included. How to manage privacy. And I also included a huge section on sexual harassment as well, which is, you know, could be the topic of another talk. But the whole point of this is, and next slide, is that really, you know, we need to stop asking women to, or menstruators to fit into a system that's oppressive, but we really just need to fix the systems. And that's it. That's all from me. Thank you.
Thank you so much. All right, I'm going to turn on my camera and stop the recording so that people can feel free, if they wish, to do the same, turn their cameras on, ask questions. Give me 1 second to stop the share and then stop the recording.